This podcast contains descriptions of violence against children and adult language and is not suitable for all audiences. Listener discretion is advised. Hi, everyone, and welcome to Suffer the Little Children, the podcast giving voices back to the victims of child abuse, murder, and their families. I'm your host, Lane, and this is episode 182, the National Children's Alliance with Teresa Huizar. The National Children's Alliance, or NCA, is a Washington, D.C.-based network of almost 1,000 children's advocacy centers, or CACs, across the United States. These centers offer crucial services to children affected by abuse, providing them with a safe space to share their stories and access a diverse team of professionals, from health practitioners to law enforcement. CACs have trained nearly 1.6 million people in child abuse prevention, and last year alone, CACs served over 380,000 children. But with this year's $600,000 cut to the Victims of Crime Act funding, CACs now face dire challenges. In this episode, you'll hear my conversation with Teresa Huizar, CEO of the NCA, to discuss what these cuts mean for CACs and the vulnerable children who rely on them. We explore how these centers operate, the impact of the funding loss, and various child abuse-related topics. Teresa's insights emphasize why advocacy and support for these centers have never been more urgent. I've mentioned child advocacy centers in many previous episodes. What I've never focused on specifically is how vital CACs are in supporting and protecting children affected by abuse, neglect, or crime. At a CAC, a team of professionals, including child welfare workers, law enforcement, health professionals, and victim advocates, come together to help children and their families navigate some of the most stressful, scary events of their lives. The Victims of Crime Act, which is funded through the United States Crime Victims Fund, or CVF, provides essential services to victims of violent crimes, such as child abuse, domestic violence, and sexual assault. The CVF is financed by monetary penalties and fines paid by defendants convicted in federal cases, and it's a huge source of support for CACs nationwide. With a massive 40% cut in funding, these centers cannot fully fund the growing demand for critical victim services. Teresa Huizar is the CEO of the NCA and a national expert on child abuse intervention and evidence-based trauma treatment. Today, I'm honored to bring you my recent conversation with Teresa. Today, I'm speaking with Teresa Huizar, the CEO of the National Children's Alliance, a Washington, D.C.-based nonprofit organization and the host of the 1 in 10 podcast. Thanks so much for joining me, Teresa.
Thanks so much for having me on.
No problem. I was looking through your podcast episodes, and I cannot wait to binge it.
Likewise, I look forward to listening to more of yours as well.
Oh, thank you. Can you tell us a little bit about yourself and your background, the organization, and how you came to be involved?
Sure. Oh, my goodness. That was a lot of questions rolled into one. Yes. Okay. So a little bit about my background. I really came to work in child abuse almost right out of college. And I started by working in an organization that did child abuse prevention. But I think for many of your listeners, they'll know that when you start working in prevention, you very quickly wind up in intervention as well, because someone will disclose abuse to you. And that happened to me. So as a young professional, it was really impactful as these children that I was talking to about prevention kept disclosing what had already happened to them, primarily child sexual abuse. And that really opened up a pathway to a career that I've had ever since. I'm 52 now, so that was a little while ago, but I've worked in the field broadly ever since. And the part of the field that I am just so incredibly passionate about are children's advocacy centers. And we're kind of one of those best kept secrets where if you haven't had a reason to know about us, you might not. Right. But children's advocacy centers serve children who have been sexually abused or criminally, physically abused or some other forms of trauma, but those are the most common. And we really wrap services around these kids. So everything from being with them from the moment of their disclosure and making sure that they are disclosing to a trained forensic interviewer who can hear that, and ask questions in a non-leading and non-traumatizing way to making sure that they get the medical care that they need for their bodies and the mental health care that they need to heal, to victim advocacy, while coordinating the investigation between CPS, law enforcement, prosecutors, and others. So, we're sort of the glue that keeps all that together in a way that's really child-focused. And all these years later, at National Children's Alliance, which is the association for such centers, I'm still just as passionate as the day that I started that work.
That's awesome. Yeah, and it's so essential. The children's advocacy centers, they do come up frequently in the episodes that I do, because there's a lot of times surviving children who witness things and need to be interviewed. And it's so important that they are interviewed, like you said, by a forensic specialist.
That's right. We want to make sure that they're not further traumatized in addition to what they've already experienced by what they've observed or abuse they've suffered themselves. And now there are nearly 1,000 of them in the U.S. that serve 381,000 children every year. So I think those numbers are sometimes shocking to people.
Yeah.
Because we'd like to think that this is rarer than it actually is.
Oh, definitely. Yeah, I know a lot of people do not know how prevalent child abuse is as a whole. And when I use the statistic that 4 to 7 kids die every day in the U.S. from abuse, it just makes people's jaws drop.
It's true.
Yeah, you don't hear it very often. And I wonder if you find this too. Sometimes it is very hard to get people to listen to anything regarding child abuse because it's so hard to hear that they'd rather just kind of bury their heads in the sand.
Oh, I've often said that the quickest way to get out of a dinner party conversation is to tell people what I actually do for a living.
No doubt.
So yes, all humor aside, I think people struggle with it. And some struggle because it may be triggering for them, based on their own experiences. But for others, I think it's just really hard to contemplate that children are treated in this way. And it makes it sometimes tempting to look away. But unfortunately, this is not something we can look away from. We have to face this head on and make sure that these children get what they need to go forward in their lives. And I think that if we don't do that, then we're harming society as a whole.
Right. Yeah, absolutely. Like they say, and it sounds trite, but it's true. They are our future. And if they're not healthy or well, then what good does that do anyone?
That's right.
When anyone asks, what's your podcast about? I kind of hold on a minute. Let me think about the best way to put this.
Right.
It's dark, but it's necessary to
talk
about.
But it's important. Yes.
Yeah. I mean, looking at your website, at your statistics page, I noticed some pretty surprising numbers that I don't think a lot of people would know. Why do you think that girls are abused more often than boys? 1 out of 4 as opposed to 1 out of 13 boys.
Well, it's a very interesting question to look at. We know, for one thing, that boys are underreporting sexual abuse even more than girls underreport it. So we suspect that number is a little higher, but still not at parity. But if you look at child sexual abuse around the world, actually it varies by country in terms of what gender identity has the most child sexual abuse. And a lot of that just simply has to do with the level of access that adult males have to whatever sex of child is available to them. So in countries in which there's very little contact between adult males, both in the family and out, and girls, you see that it tends to be boys that have higher sexual abuse rates. In our country, in many countries in which both genders have about equal access to adult males and vice versa, then you see that they tend to be victimized more. So it's interesting that there's also a sort of cultural access component to the question that you're asking.
The page said that boys have a higher fatality rate, and I really wonder about that as well, because I think I cover about 50-50, but it's probably not exactly
that when you look at the statistics.
Right.
Yes, and I think we know a little bit less actually about child abuse fatalities in terms of the accuracy of the reporting around what gets classified as a child abuse fatality than we do something like child sexual abuse or physical abuse or neglect when children are over. So that's another case where I think we have good reason to think that there are cases beyond what are officially reported that are actually child abuse fatalities, and that we need to know more about that before we'll know exactly the gender breakout. However, I think one of the things that we can acknowledge overall is that all of these are crimes of gender-based violence to some degree. And we can't ignore, in the U.S., for example, the specific vulnerabilities that women and girls have to sexual abuse and assault across their lifespan.
Right, definitely. So I'd say in about 75% of the cases I cover, they involve CPS or a similar agency in some way. There's some contact. I wondered what your thoughts are on child welfare agencies around the country and how effective they are at protecting and intervening. And I know that the prioritization of reunification has a lot to do with some of the fatalities that I've talked about.
I think that there are several issues at play, one of which is that we have a system that sort of waits until something has happened after the fact, often to really provide resources to struggling families. So when we think about some of the drivers for child abuse fatalities, which can include a whole host of things, very young parents and inexperienced parents, coupled with economic pressures, coupled with substance abuse, coupled with sometimes mental health issues and domestic violence and other things, you can see how this sort of cocktail of fragility in the family can lead to a terrible result. But if we're not identifying those families until they've already gotten into a terrible state and something bad has already happened, then it makes it much more likely that at the end of the day, there's not going to be a good outcome. The other thing that I think contributes to that is in this country, we don't have a good way or even any laws that really set red flags around cases in which there may seem to be minor reports, but there's a whole series of them. And so, as you know from your own work, a lot of child abuse fatalities are not one catastrophic event. You know, surprise, here's a child abuse fatality. Instead of it just being a singular event, often there's a series of low-level reports that come in over time. So a family may be reported 5 or 6 times, but it may be not just all involving the same child, or they could be what could be classified as relatively minor events. And then there's the fatality. And so I think one of the things that we have to start thinking about is where there's smoke, there's fire. Where there are 5 or 6 reports, that should really generate a serious red flag that the family needs further looking into and further support, and not to simply say that it's based on the extreme nature of a report. And so until we do those things, I think the work of CPS is going to continue to be under-resourced, hampered, and not function well for what we're trying to do in terms of protecting kids.
It does seem like it could be a lack of resources, some very overworked caseworkers. And
that's right. High turnover. I mean, the average length of time for an intake worker is 18 months. I mean, wow. That's the entirety of their career.
Yeah.
So that just does not allow folks to generate and develop the kind of expertise needed to handle these cases, I think, in the way that we would want them handled.
Yeah, that's a huge problem is a lot of times these families are reported a number of times. And even if the children are taken away, the priority for DCS or CPS, whatever the agency's called, is reunifying these families when sometimes it's just not in the child's best interest. But there's so many nuances in there that it's so hard to talk about and to know which family should have reunification and which shouldn't.
Well, and I think this points to the importance of multidisciplinary teamwork. We know that no one discipline has all the information on a family needed to assess both what's going on and what should go on in the future. So, for example, it's very common that CPS might have one set of data, but law enforcement has a whole set of contacts that are completely different.
Now for a word from my sponsors.
We've been involved in child abuse fatality prevention legislation in the past and looked at all that state by state. But I will just say that I think one of the saddest things when you start digging into that is that really there is no place in the U.S. in which children are entirely safe.
No, definitely not. It's not just the kids who are abused who suffer repercussions, although I'm sure the CACs handle mostly dealing with those kids. But when a targeted or scapegoated child is abused and does die, how does that, and sometimes the parent's subsequent arrest, affect the other kids in the house who witnessed? And sometimes it's awful, but sometimes they're forced to participate for their own self-preservation. How does all of that affect those kids, and how do child advocacy centers help those kids?
It's not at all uncommon for children's advocacy centers to both interview and provide services to other children in the household, whether it's a child abuse fatality where they were abused to death or a victim, but they survive. And so if it's a case in which the victim does not pass, we want to make sure that other children haven't been victimized as well. And that's actually fairly common that they have. So that's our first and foremost. We want to make sure that the other children in the household are safe and protected. But the other thing is that they are witnesses as well, even if not of the incident that harmed or even killed a particular child, but certainly the various other acts that may have happened within the household. And so again, we want to make sure that all the children in the household are safe. And if they're going to be questioned as witnesses, that's done in a proper and appropriate way and in a non-traumatizing way, because it also then acts as a gateway to services. Those kids may very well need mental health care as well, and children's advocacy centers will provide that to them too. So they may need a physical exam as well, especially in the case of physical abuse or a child abuse fatality that ties to physical abuse. They may need something like a long bone scan or other things to just see whether there are prior healed injuries. And so that is something that may be arranged through the multidisciplinary team too. So I think that, one of the things that we are careful about in children's advocacy centers is not to simply focus on one child who made a report. We want to make sure that that child is central to the focus of it. But if there are other children in the household, then we have to be concerned about them as well and make sure that they have access to services as well.
That's what I wonder about, is because sometimes when it's a targeted child situation and the other children do have to participate in it, that must be if the other child passed away, sure, it would be survivor's guilt, but it's got to be similar if the child is still alive, but the other kids still participated. Do you have any experience in that?
Well, I think that the thing to keep in mind is that children in all forms of child abuse wind up taking on feelings of stigma and shame and guilt that is not theirs to bear, right? It's the offender's to bear. But that is not an unfrequent response to that. And also, let's keep in mind that whether or not they're forced to take a specific action or participate in the abuse in some way, they're often essentially told to feel complicit by the offending parent anyway, told that it's somehow their fault or something of that nature. So these dynamics are not uncommon at all. And the good news here is that evidence-based treatment for child trauma addresses those. And so whether they're feeling shame, whether they're feeling stigma, whether they're feeling guilt, whether they feel it because they've been told to feel it, or it's survivor's guilt, or because they were somehow forced to be complicit, all of that can be addressed effectively through evidence-based treatment. And the earlier, frankly, that we intervene with those kids and get them help, the better.
That's really great to hear that there's such good treatment available. And yeah, that was something I really wondered about, because I see it an awful lot in these cases, and I'm no expert. I just happen to know a lot of these stories, unfortunately, but there are definitely commonalities throughout. And I wondered, what commonalities do you see throughout child abuse cases that you're familiar with?
Well, I think in all cases, there's the trauma of the abuse itself, and that has to be dealt with. I think in prior generations, there was sort of a feeling of maybe that would just go away on its own, or maybe it'd be better not to talk about it. Maybe the child would forget. Fortunately, we know now that none of that is true. People do not forget. It doesn't just somehow miraculously heal itself, that people do need treatment, and that there's an enormous body of evidence about what works now. When I started my career all those years ago, there was very little research on what worked in terms of helping kids heal from abuse and prevent PTSD from forming and address it when it does. But now there's lots of evidence about what works and what doesn't. So we really can apply the right treatment to the individual situation so that kids can get better. Now, that's assuming that treatment is available. That's assuming there are enough clinicians that have been trained, and that's assuming that there are the financial resources to provide it. One of the things that's unique about children's advocacy centers is that we require children's advocacy centers not to use a client's ability to pay as a way of determining whether or not they get treatment.
That's amazing.
So this means that every child advocacy center in the country is doing two things. One, they're doing private fundraising to try to cover those costs for families who can't. Most of them do not accept third-party billing for insurance, that kind of thing. So they're raising money privately for that. And The Victims of Crime Act picks up the tab, or has historically, for a great deal of this treatment and medical care and victim advocacy, and even forensic interviews. And so, that's one of the reasons that we're so concerned about those dollars being threatened, because most of these families are not families that, left to their own devices, could pay $300 an hour for therapy. In fact, most Americans couldn't pay $300 per hour for therapy out of pocket for the length of time that a child might need it in one of these cases. So I think we have to be thinking about, just as a society, what do we want to be available when these horrible things happen? If, God forbid, someone we love would be harmed, or somebody in our extended family, or a friend's child, what would we want the response in the U.S. to be like? And we have to make sure that there are adequate resources in children's advocacy centers and other places to ensure that whatever the answer to that question is, that it's not a dream, it's not a hope, it's an actuality.
Right. Do you want to talk about that? How the VOCA Act grants have been basically slashed by $600 million, was it?
Yeah, I really appreciate you asking about this, because I think that most Americans do not at all understand, how victim services are available and paid for in this country. No. I think most people probably think that state government is bearing the entire tab, or somehow the federal government is paying for it all. And actually, it's a lot more tenuous than that. The Victims of Crime Act was passed by Congress 40 years ago, 40 years on October 15th, as a matter of fact. Right. And it really should be, in a lot of ways, a celebration for our country that 40 years ago, there was really the political will in Congress, but also in the citizenry, to say, we want services to be available to victims of crime, whether that's child abuse, as we've been talking about today, or whether that's domestic violence or adult sexual assault or other serious crimes that happen. And that's not funded by taxpayers, actually. That is funded through the Crime Victims Fund by fines and fees collected on federal convictions of crime, deferred prosecution, and settlement agreements. So when somebody is a malefactor or wrongdoer federally, there's an opportunity to collect those fines and fees. And the idea is those flow into a fund that go then out to fund victim services. And that is a really nice idea. And it worked well for a long time. But a lot has shifted over 40 years. And so what we've really seen is that the receipts coming into the Crime Victims Fund have dropped dramatically over the last number of years, and especially the last 4. And so those dollars that get collected in that federal fund flow out to states and then out to local programs. Well, if there's not as much money in the fund, it's easy to see what the downstream effects of that are going to be. That ultimately, children's advocacy centers, domestic violence shelters, services for adult sexual assault survivors, and others are going to be slashed. So let me give you an example of what that looks like. In federal fiscal year 2022, $2.6 billion was allocated for victim services around the country. If you look at FY24, so federal fiscal year 24, it was about half that, $1.35 billion. And the difference between the prior year and the current year is the $600 million cut you just talked about. So we're talking about enormous year over year cuts, so that, for example, in a 2-year period, really almost a 50% cut that programs have taken. And we have to think about what that really means by way of cuts to services. It's really just like your pocketbook, right? And my pocketbook. If somebody says you need to take a little bit of a cut and they give you a 5% or a 10% cut or whatever, okay, you might cut out your cable package. You might cut back on going out to eat or whatever. But if they cut your pay by 50%, what would you have to cut in order to live, right? And it's the same thing for these programs. What has to be cut in order for them to survive when we're talking about these kind of cuts? And the truth is, there is no way to do that without cutting essential services to kids.
It just seems like a no-brainer, but
it's math.
Yeah,
right?
Exactly.
It's math.
But if people don't know about it and don't understand that that's what's going on, then there's no way to fix it. I'll pause here for another word from my sponsors. How can we help fix this?
Well, I think that's the most important question of all. I mean, fortunately, a bipartisan group of Congress people have come together and really looked at this question and said, look, we've got to find some answer to this. This is not working. And so they put forward the Crime Victims Fund Stabilization Act. And I know it's a very long name. These names always are in terms of federal legislation, but it actually is very simple. It really says, look, the fund is not filling as fast as it should. We kind of need a runway while we're working on a very long-term solution to this to, in the short run, refill the fund. And so what it does is route leftover False Claims Act money, and we can talk about what that is in a second, but it sort of routes leftover revenue into the Crime Victims Fund and just sort of pools that in there and says, okay, let's just sort of plump up this fund over the next 5 years while we work on a longer term fix. Now, I know if your listeners have not heard of the Victims of Crime Act and they haven't heard of the Crime Victims Fund, they certainly probably have never heard of the False Claims Act. But just in a very brief description of that, if somebody defrauds the federal government, in other words, think about Medicare fraud or Medicaid fraud or something like that. If they defraud the federal government, we want to encourage somebody to blow the whistle on that. And what the False Claims Act does is say that when somebody defrauds the federal government, in civil penalties, they can wind up with 3 times the amount that they defrauded the federal government plus penalties. That all flows into a big pool. And the defrauded agency, so the Department of Justice or the Department of Education or the Department of Health and Human Services, whatever it is, gets paid back. And then the whistleblower gets paid. But then there's this leftover money, because remember we said 3 times the amount plus penalty. That unobligated money, if it's not directed anywhere else, just goes into the general treasury. What the Crime Victims Fund Stabilization Act does is it just takes that leftover money and says, temporarily for the next 5 years, those leftover funds, after we've paid back the government, after we've paid back whistleblowers, that's going to go into the Crime Victims Fund and help victims. So it's easy peasy. Once again, it is not taxpayer money. Once again, it is really coming from the wrongdoing of others. And I'm pleased to say that on the House side, it now has 170 co-sponsors and counting. So we're just wanting to see even more people get on board with this.
Definitely. That's really interesting. And I had no idea that that's where the funds come from for services like yours and domestic violence shelters and things like that. So it is more critical than I even thought when we first went into this.
Yes, I think most people don't know. I really do. When you talk to sort of the person on the street about, do you want these services to exist in their community? Well, of course. And in fact, for most people, for most of their life, if not all of it, these services have existed. And so there's no disagreement that people want kids to get help when they need it and these kinds of things. It's more that there's just this lack of knowledge about, first of all, how it's funded, and that the funding is so uneven and it fluctuates so much. I mean, the truth is, to the degree that we improve crime in this country, we actually, because of the way this is set up, we reduce the amount of money available to help victims.
Right.
Now, long term, we've got to get the incentives going in the right direction. And I think that that may not be exactly how we want to structure it forever. But in the short term, well, it is structured this way. I think the easiest, simplest, and best fix is to see that we route other revenue into the fund that can be helpful. And so I think if listeners are thinking, well, what can I do? I'm not a member of Congress. What can I do? What you can do is reach out to your members of Congress, either through emailing them or through calling them, or right now in October, they're back in their districts and back in their states ahead of the election, and just let them know to find out more about this and support it. And on the House side, it's House Bill 8061. On the Senate side, it's Senate Bill 4514. And it's just a way to really assist this in a simple way that doesn't draw on taxpayer dollars. So anything that listeners can do just to remind people about that and ask them to support it, pass it, co-sponsor it, do all the things would be greatly appreciated, because the clock is ticking. I've told you how much it dropped for federal year 24, but 25 looks even more grim. And if folks want more information about those, they can go to our website at nationalchildren'salliance.org. There's a page about the Victims of Crime Act, or VOCA. You'll just see VOCA. And feel free to just drop down on that, look at that page, and we've got all the things where folks can learn more if they're interested in more information about that. I also would be remiss if I didn't thank all the folks in Congress who've already supported it. I can't tell you what a group of champions these first 170 House co-sponsors have been. They've just been rock stars, and we appreciate it. Congresswoman Ann Wagner, especially. She's a Republican Congresswoman out of Missouri, and she is just a true champion for children, and we really appreciate her leadership on this. But as I've said, it's bipartisan. It has support on both sides of the aisle. And we just really know that what can happen during an election year is that a lot is going on, right? It's easy to get distracted and focused on other things. But what we're asking Congress to do is turn their attention back to this and make sure that this gets solved before the clock really runs out on services to kids.
Yeah, absolutely. I'm going to include links to a lot of the pertinent topics.
Thank you so much.
Oh, of course. Yeah, I'll have your website, your podcast, and I'll look up the info on the bills and things like that to make it easy for everyone to find it.
I appreciate you so much.
No problem at all. Time for another sponsor break. I wanted to know too, on a more specific topic, I guess, I wanted to go through and binge your podcast. There are a lot of topics I could tell just from the titles that I'm already familiar with just from covering these stories. Can you talk about the podcast a little bit and where people can listen to it and things like that?
Sure. The podcast has a little bit of a funny origin story in that we started this several years ago, 1 in 10 podcast. And you can find it on Apple Podcast or any place you listen. You can also find a link on our website as well. But we really started because we wanted, in the month of April, as a Child Abuse Prevention Month bonus, we thought we were just going to do 4 podcast episodes and cover things that we had not seen covered recently, just recent research that we would put out to the field. And talking to researchers about what's new, what's out there, sort of the brightest minds working on this challenging problem. And we just kept going because there was always a next paper, a next interesting piece of research, a next interesting practitioner to talk to. Yeah. So now, these years later, we're at more than 100 episodes and counting. I know. It's really funny. But what we try to do, the particular niche we try to fill is, when I was a CAC director myself, I did not have time to read journal articles. I mean, I wish I did. That would have been lovely, but I didn't. So what we try to focus on is kind of research to practice by talking to researchers in a really conversational way and applying it directly to what child abuse professionals are dealing with every day. So we try to do that in a way that's both really practical and that makes you feel like you're just listening in to two, sort of our thought going into this is, imagine at a child abuse conference, you have 2 people who know about child abuse that are sitting at a bar and over the glass of wine, they're talking about the dilemmas they're facing and recent research to help with that. That's what we want that experience to be like. So I hope listeners find that experience, if they check it out, that is what it's like, because we want it to be practical and rooted in things that child abuse professionals can take action on today.
That's excellent. I love that. I was going to ask you about the topic of Munchausen syndrome by proxy or medical child abuse.
Yes.
And I have told the stories of a number of kids affected by it, and some were survivors and some were not. But there are next to no resources for survivors of medical child abuse. It's crazy how few there are. APSAC has a Munchausen by proxy committee.
Yes. That is a really interesting topic, and I appreciate you bringing it up. And I have to tell you, doctors that are working in that space right now are really under attack in the legal system. And I think there's a lot of misinformation that's out there about medical child abuse and a lot of skepticism that it really exists. But for those who are child abuse professionals, we really know that it exists. And your listeners do too, from the stories that you've covered.
Right. And I think there was that Netflix documentary, I can't think of the name of it, just recently within the last year or so. And it was The mother was accused of having Munchausen by proxy, but it turned out she didn't, I think it was. Whenever something like that happens, then people kind of swing the opposite way, and that's probably a lot to do with why they're under fire. But even police aren't as well versed in it as they should or could be. And of course, there are no specific doctors or therapists that I've been able to find. There was a survivor that I'm now close friends with. I've covered her family story. There were a number of kids involved, and she's just suffered through a lot, substance abuse and doctor and hospital aversion, ongoing trauma, nightmares well into her 40s, re-victimization because she's already traumatized, that sort of thing.
Well, and can you even imagine trying to go to the doctor after you'd had a horrible experience like that as a child? I mean, as an adult, right. I can imagine that would affect your wellness your whole life. I mean, your physical wellness.
Absolutely.
Yeah.
I wonder what can be done about the lack of resources for those specific people. I know it is a limited population, but I think it is larger than we think it is.
I think so too. And I think that, children's hospitals tend to get those cases more than some of the others. For one thing, because they tend to be trauma 1 centers, and these are complicated cases to deal with. But secondly, they really are the ones with child abuse pediatricians on site. There are children's hospitals who have a children's advocacy center as one of their clinic, but not many. It's really a handful. So it does make me wonder whether there needs to be a closer link between children's advocacy centers and children's hospitals where the children's advocacy center is separate from them, if they don't already have a close connection, because there's nothing that would prevent a children's advocacy center from providing therapy to those kids, whether or not they were the ones who provided the medical intervention in those cases.
That would be helpful, yeah. And then some kind of resources, even for adult survivors, because
absolutely,
a lot of them don't disclose or don't realize what happened to them
until they're
early on.
Yeah,
exactly. And it's pretty sad to see that they can't get the help they need. So, yeah, that one, for some reason, it just, people don't understand how it happens. And that's the hard part, I think.
Well, I think with all forms of abuse, if you're not a person who would do those things, it's very hard to come to grips with the fact that there are people who would sexually abuse a child, physically abuse a child, neglect a child to death, or in this case, have unnecessary medical interventions, sometimes even to the point that those medical interventions or what someone is doing to provoke the medical intervention actually kills the child. I mean, it just seems so otherworldly almost. But I think we have to move past denial as a country. All of these things happen right here in the U.S. and right here in our local communities, and they're all someone's neighbor,
right?
So we have a sort of universal responsibility to keep an eye out on the children in our lives and our communities because they need our help and attention.
And if you see something, say something doesn't just apply to terrorism. It's so hard for people to accept that they may have to report their sister or someone close to them for abusing or neglecting their children. But we have to put children's needs ahead of everyone else. It's so hard to tell people that, though. How do you explain that to people?
Well, I think that in many cases, it's been interesting because we do see some child abuse reports that come in, especially from grandparents, interestingly enough, more than siblings necessarily or that sort of thing, and where they're very worried about what's going on in the family. I think especially in neglect cases, we may see that. And you have to think about how brave it is to do it, and also the point something must have gotten to for a grandparent or a sibling or another family member to say, I'm really worried about somebody in my family. But speaking about gaps in the system, those reports are not treated differently than any other kind of report. And I think one of the things that we might argue is that it might be better for them to be given additional weight, because you have to think about the fact that if these are the individuals that are closest to the kids and family, and they're tremendously worried enough to overcome their fear, their denial, their desire not to have to intervene in order to pick up the phone and make that call, that's a super brave action. And we should take it extremely seriously when that happens.
Yeah, definitely. I can tell you a lot of these stories that I've told have grandparents, as you said, surprising numbers of grandparents having reached out and done something about it. To no avail is the problem. Is they don't, like you said, don't take it as any different. But
That's right.
They're the people closest, who do know something's wrong. Now for one last sponsor break.
I will say I do feel a sense of hopefulness, however, in terms of child abuse. I think that when I started my career, and remember a case that really sticks in my mind because it was a little girl who had been sexually abused, and she came and told her grandmother right away, and her grandmother reported it right away. But when they came to the Children's Advocacy Center, I can't remember where she was, at work or something, and the grandparents brought the child. And the grandmother seemed, anyone would be very distraught. Anybody would be very upset. But she seemed extremely distressed. And so I talked with her privately, and she disclosed that she had been sexually abused as a child. Now, at that point, she was in her mid-60s. And she told me that I was the first person she had ever told that.
Yeah.
She had not ever told her husband. They'd been married all of those many, many years. She had never told anybody in her family. She had never told a friend, anyone else. And she was really proud of her granddaughter for coming and reporting it right away. So I think that, and when you see statistics, it also bears it out that, kids now feel more empowered to tell when something has happened. They're more likely to know somebody they could tell if something happened to them. The length of time between an incident and the disclosure, while it still may be delayed, is shorter than it was in the past. So while it's very discouraging when you talk about individual child abuse cases, I do feel that as a society, we've made some important gains, and we need to continue to build on those gains.
Yeah, you're right. It's probably more of the individual cases that are discouraging. I do feel like talking about the individual cases is important.
Oh, absolutely.
Yeah. Well, in that they kind of educate people and tell people, here's what's going on behind closed doors. And if you're not looking for it, then you don't know what to look for. And that's a question I wanted to ask you too, is I talk about the signs and symptoms of child abuse all the time, but what would you say are the important things to watch out for in your family members, your grandchildren, your nieces, nephews, or your friends' kids?
Well, first of all, let me just say that I think looking at individual cases is important too, because we can pick up on patterns of things and devise interventions that can be really helpful for that. But the other thing is it can help something good come out of a terrible, tragic situation. These kids deserve to be memorialized. They deserve to be remembered, and they deserve to have some good come out of their deaths in terms of educating other people so that it prevents other future harm and future deaths. So I really applaud you and your listeners for taking action to remember these children, what they've gone through, and to use that as a point to hopefully better protect other kids. In terms of signs, I think that one of the things we have to think about is sort of what types of abuse, because the signs are somewhat different. In physical abuse, in some ways, that may be one of the easier ones to pick up on, in that often kids will have physical signs on their bodies that are just sort of inexplicable. The child that tells you that they got an injury by falling off their bike or falling down, but it's not an injury that could have happened that way.
Like an ear or something like that. Yeah.
That's right. Or we can see marks and bruises that are in the shape of objects or hands or handprints. That's very common. Or if you have a child that's not yet walking, any injury at all is something that should throw up a red flag, that you just shouldn't see bruises in a child that's so young that they're not really ambulatory. So I think all of those are things to pay attention to with physical abuse. With sexual abuse, it's not so much the physical sign. It's other things like dramatic changes in behavior, kids becoming very withdrawn, kids regressing in behavior to younger stages. So it could be bedwetting. It could be nightmares and night terrors going on continuously. It could be kids who are avoidant of a person. I think that that's something that we don't pay enough attention to, that a kid who always loved going over to so-and-so's house and now they don't ever want to go anymore. They don't want to be left alone with them. They're not excited. They seem sad or anxious when you say we're going over to grandpa's house or Uncle John's house or a family friend. That's something we need to inquire more about. It may not be that it's abuse, but it's worth at least asking the question why they're feeling uncomfortable.
Yeah.
And I think in many cases, what we also need to do simultaneously to recognizing signs ourselves is also not put kids in situations that are dangerous. I mean, in general, when we're talking about cases that could involve coaches, Boy Scouts, clergy, Girl Scouts, all of these things, we have to think about the fact that really children should not be left alone with one adult. There needs to be more than one with line of sight on them at all times. And if you're with a reputable program, wasn't known, years ago when we were little, but these days, reputable programs have rules about that. And they don't mind you asking about those rules. So to me, a red flag would be if any adult who's in a position of trust in any way, a teacher, a coach, clergy, anybody else, they act offended when you ask about those things, or they can't tell you what the rules are about preventing one adult, one child contact, that's to me a huge red flag. Again, it may not be because they're doing something, but it certainly means that they wouldn't know if anything were happening. And in that way, it's unsafe.
And it warrants looking further into either way.
Absolutely.
And then as far as neglect, what would you say? I mean, obviously weight loss and hygiene issues and things like that.
Well, I think that, sadly, neglect is often one of those things that's hidden quite a bit until kids are school age. Because if you think about it, a parent can keep a child in the house. I mean, truly physically in the house. And this is often what we hear from neighbors, right? They say, well, I never saw the kids outside. I never saw the inside of the house. They were very hostile when I came over to talk to them and wouldn't even open the door.
So I didn't know that child existed.
Yeah, exactly. So I think until children are a little older, that is more difficult to pick up on. But I do think often when it is picked up on, it comes up because kids are stealing food, or they're going over to neighbor homes for food or other things. Or when they get to school, they are clearly not having enough food, clothes, cleanliness, hygiene, all of those things, so that it raises the alarm of a teacher and the teacher reports. Speaking of people who, if they report, we should take it very seriously, let me just say that daycare providers and teachers should also rank right up there because they're with kids 8 hours a day. So if they're seeing a continuous pattern of problems, and that's usually how it arises with neglect, right? It's not that you see a child one time and they have these issues. It's more the fact that over a period of time or a pattern, they're saying, I was left at home for 3 days with only a box of cereal. They seem never to have lunch. They seem never to be clean. They seem never to have slept all night because they've been kept up all night with domestic violence going on in the house and other things. It's that constellation of events that I think we want to pay attention to, and we want CPS to react to when they get these reports from teachers or others, and not treat them as minimal things like, well, that could be anything. Maybe that's not so serious. It's serious enough that it warrants paying attention to if there's a pattern for sure, because that can be the precursor to something more serious. And the other thing I would just point out for listeners is that a lot of people don't realize that neglect also can set the stage for child sexual abuse. Because in neglectful situations that are driven by domestic violence and substance abuse, that can create a chaotic household in which no one is really supervising children and paying attention to who is with them and when, and a host of different unrelated people in and out of the household. And that situation is ripe for the creation of child sexual abuse. So actually, we see some overlap between child sexual abuse cases that have co-occurring neglect as a part of them that often was even the precursor to the child sexual abuse.
Yeah, that's very interesting. I don't know that people would think of that.
That's right.
Well, I appreciate the information you've shared with us and expertise, because I can't think of anyone better to tell us about these things. And you ran your own CAC.
Yes, 2 of them at different times. So yes, I love this work, both in the work we did with families directly and the work I get to do now, advocating on behalf of those who are working directly with families. But I just really appreciate you and your listeners caring so much about this issue, caring about these kids and wanting to make sure they get what they need, and caring about the public policy side of this as well, and making sure that Congress is paying attention to making sure that kids get what they need.
Absolutely. Yeah, I've got a lot of family members I've talked to who have gotten laws passed or still trying to get laws passed. And I think that's so important because it all depends where you are, what state you're in, and who your reps are, whether or not they're paying attention to this sort of stuff. So
they listen to voters, though.
Right.
And I think now is a prime time. I mean, if you think about it, election season, which I think, all of us can get tired of from time to time.
Yes.
But it is the time when members of Congress are listening the most because many of them are in an election cycle themselves. So I would just say, take this time between now and the election to get your word in advocating for kids. And we thank you in advance for that.
Yeah, that's a great idea. So definitely speaking up about VOCA and any other laws that need to be passed would be important.
That's right.
Now.
Well, thanks again for advocating for the Crime Victims Fund Stabilization Act. And we look forward to hopefully being able to report back some success on that and making sure that kids get all of these services that we've been talking about that they so dearly need when they've been traumatized by abuse.
Absolutely. Thank you again. I appreciate you coming on and talking with us. I'd be glad to have you back anytime.
Thank you so much. It's been truly a pleasure.
I can't thank Teresa enough for taking the time out of her packed schedule to talk with me. I very much enjoyed our conversation, and I appreciate her expert insights on so many topics. I also can't stress enough how important it is for all of us who live in the United States to reach out to our House representatives and U.S. senators. I've made it simple by including links in the show notes to the House and Senate versions of the Crime Victims Fund Stabilization Act. I also provided links to find your representatives and senators and to find out if they co-sponsor either bill yet. Please take a minute to email your Congressional House rep and ask them to co-sponsor the House bill, and email your senator and ask them to co-sponsor the Senate bill. The kids I talk about in every episode and their surviving siblings need access to child advocacy centers and the services they provide, and this is a real, tangible way we can help these kids. Thanks, everyone. Before I end the episode, I'd like to give a quick shout-out to my newest patrons, Stephanie B. from Independence, Missouri, Joanna S. from Mayorga, Portugal, Heather A. from Picnic Point, New South Wales, Australia, Stevie S. from Edwardsville, Kansas, Rebecca R. from Cedar Grove, Wisconsin, and Lisa D. from somewhere near me in northern New Jersey. Thank you all so much for your support. Patrons at the $5 level and up get access to ad-free versions of my episodes, and at $10 and up, you get early access to those ad-free episodes. I know I haven't been putting out weekly episodes for a while, but I promise I'm trying my best, and I have 2 more planned for this month, so stay tuned. That's it for this episode. Join me next time for another child's story. If you like the show, please follow or subscribe to Suffer the Little Children on Apple Podcasts, Google Podcasts, YouTube, Spotify, Spreaker, Pandora, iHeartRadio, Stitcher, or your favorite podcast listening app. And please leave me a 5-star rating and a positive review on your favorite podcast platform. Visit the website at sufferthelittlechildrenpod.com. You can support the show by visiting patreon.com/stlcpod, where you can become a patron for rewards ranging from a shout-out by name on the show to bonus content and exclusive gifts. You can also support the show at ko-fi.com/stlcpod. Follow the podcast on Facebook and Instagram at Suffer the Little Children Pod and on TikTok at STLCpod. View photos related to today's episode on Facebook. This podcast is researched, written, hosted, edited, and produced by Lane. Intro theme music is by Dream Note Music, and all music for the show is licensed from audiojungle.net. For more information about preventing or reporting child abuse, visit childhelp.org or call your area's child abuse hotline. And remember, if you see something, say something.